in anticipation to the Medicaid cuts. Curtis Medical Center in rural Nebraska has announced that it's going to be closing, and it does cite the anticipated cuts to Medicaid as one of the reasons they are closing. So this is only the beginning, folks. You can try to sugarcoat it all you want. This is what's going to happen.
Nebraska is probably really pissed that they voted for Trump now, huh? Because everybody that's like, no, Medicaid's not gonna close clinics and Medicaid's not gonna close hospitals. Ask Nebraska how one of their clinics is now being closed. Why, you might ask? Because of Medicaid cuts. Because of Medicaid cuts. And that's just the first to downfall publicly. Imagine all the small ones that's going to close without the public knowing. And yes, my face is greasy because I got on sunblock because I'm about to get outside. But listen, I'm trying to tell you, it is about to get real ugly in America. Y'all just wait and see all you nurses and CNAs and LPNs and doctors. Yeah, you might want to go look for a new job because you're about to get terminated. Thanks to Trump. Go thank your president.
Hello, lovely humans. I'm just gonna get right into it. Tell you how this is affecting my state, where the majority voted for this. Here's how these proposed budget reconciliation, I will not call it by that other freaking name, would likely impact healthcare in Nebraska if it passes in its current form. Coverage in Medicaid enrollment. Up to 55,000 Nebraskans could lose healthcare coverage under the House version. Well, this has been updated a bit, hasn't it? I made this a little while ago. Nationally, the CBO estimates 7.8 fewer people on Medicaid through 2034. Nebraska shares in that loss. State funding and finance. Nebraska stands to lose roughly $4 billion in federal Medicaid money over the next decade. Cuts to state-directed payments and provider taxes means rural hospitals and nursing homes would see reduced benefits, as Nebraska will be subject to the caps. Sure, you've heard about one of our rural hospitals closing as of today. Economic impact. Nebraska's economy is projected to shrink by approximately $477 million per year at full implementation due to Medicaid cuts. The increased burden of uncompensated care and reduced state and local revenue, including potential job losses, would further strain budgets. The healthcare system effects. Hospitals, especially rural ones, I live in a rural area, would face steep increases in uncompensated care, likely causing more closures or reduced services. Example, emergency room hours.
Get paid.
Preventative care delays, longer ER wait times, and weaker healthcare outcomes are expected, affecting both Medicaid and privately insured patients. The impact on children and families. Very rich from this administration, Census Party and their affiliated fans, as I'll put it, are so pro-life. Nearly 30% of Nebraska children rely on Medicaid. Funding cuts jeopardize access to pediatric and family health care. Additional eligibility tightening and work requirements threaten SHIP and expansion benefits. The broader consequences. State governments may need to divert funds from areas like education, infrastructure, or public safety to offset lost funding. Job losses in healthcare and supporting industries could ripple out, further weakening local economies. Doesn't this just sound great? Include substantial coverage losses, service reductions in healthcare, economic contraction, and critical strain on rural health infrastructure. Surprise, surprise. State leaders are already evaluating budget planning and preparing for these possible outcomes as the Senate moves toward a vote. That was before the Senate did what they fucking did. Yeah.
Wow, you guys. So to say that we're going to be in a situation where we got kids and some elders maybe not having insurance. Are you kidding me? The babies, the elders. Come on now. This don't make no sense. Now this bill is causing hospitals to shut down in Nebraska. Clinics. And what's going to happen is people going to move to other clinics, overcrowd them. Appointments go be off the chain to even get an appointment. People going to be in tears because they're losing their insurance. And this is like so devastating to people. So devastating to people that relied on this service.
I hope all of you who voted for this, I don't even know if I can call him a man, much less a human. I hope you all get genuinely what you voted for. It just really sucks that the rest of us who had, at bare minimum, 2 brain cells to rub together to form a synapses and have critical thinking skills have to go through this crap with you.
I've been acting all day like they're going to pass the bill because I know they're going to pass the bill. That budget framework is going to hurt a lot of people. And I went to the fact-checking site because they were fact-checking how many expected facilities are there to close in the country due to the Medicaid cuts. They sent out a bunch of surveys, so this is statistical analysis and verifiable statistical analysis. Now, there is a Southwest Nebraska one already closing. They're expecting that they will not be able to survive. So that facility is already announced today they will close, and that's in the western south part of the state of Nebraska. But it's not just Nebraska. 21% of those surveyed, hospitals, doctors' facilities, clinics, and nursing homes, 27% say they're going to have to close. That's huge. That's that many facilities times however many employees, times however many people that are in there, plus all the medical devices and equipment and services and medications that they all receive. Gone in a flash of an eye.
Dang.
So when those little people with the hatters come on into your comments and tell you that you're trying to scare people and that you don't know what you're talking about and you better crack a book and get your head out of your rear end and all those other things they like to say to us, point out that there are statistical analysis that has already been done, and 27%, and this is mostly rural. In fact, Louisiana, I believe, will only have 2 available open after the whole thing goes down. So tell those people that don't want to listen, they're the ones that are wrong. There is statistical studies now with surveys that have factual backed up information. It's going to happen. Might not be right away because, like I said in my earlier post today, the things are scheduled over time, but in the long run, this is 27% of our facilities will close.
Hello. Hope everybody's having a good one. So, as I reported before, Donald Trump's big, beautiful bill has passed. And I want you MAGAs and the Republicans that voted for this bill realize that this is Donald Trump's bill. So any problem that comes from this bill, it's not going to be Biden or Barack, or even need to make sure this is his bill, that you're not going to blame poor Biden for this, because this bill is going to cause a problem for several years. The problem starts now, but it's not just going to stop next year. It's going to cause continuous problem. They're anticipating into 2034 is when they're saying now 17 million people, it's not 11 anymore, 17 million people will lose their insurance. So MAGA, be sure you're going to just keep, this is Donald Trump's bill, nobody else's. So let's speak of the problem that is started right now. In Nebraska, there's a rural clinic in Nebraska. According to a news channel, 8 ABC, that's a news channel, they have reported that this clinic is already closing in anticipation of losing the funding from Medicaid. They said the clinic was having some financial problem already, and due to the anticipation of this bill and all the money that they're going to be losing because of the cut from Medicaid, they're closing this clinic that is in Nebraska. Yes, this is true story.
Wow, guys, you hear it, man. The big, beautiful bill don't look so beautiful for some people. Some people are really feeling this in a negative way. Sorry about the thunder. Nature is happening outside. It's storming today. So yeah, the big, beautiful bill look like a big problem for people that need insurance. And the clinics that drop people are going to have to pick those people up somewhere else if they still have insurance, and it's going to be flooded, and your appointment might be 3 months down the list. This is a lot to cipher in. Let me know what you think down in the comment. I'm Tiffany Rose. If you're new to the channel, hi, how are you? I'm Tiffany, and let me know what y'all think about this bill. Did you get affected? Anybody in my comments lose their insurance because of the bill? I'm out. Keep your eyes open.
If you are a believer, you're born again, you are called to be a watchman or watchwoman or watch person, doesn't matter. So it means you are someone who's to behold, to look up. You're called to be one who waits on the Lord.